Okay, do we need to like stretch and stand up and do a little like rah-rah for a minute before we bring our next group up? Okay, so thank you all for being here. I'm Jennifer Haddad Bell. I use she, her pronouns. I have had the privilege of working with the Leadership Council since it started, almost 10 years ago, this body of work started. And so I wear many hats. So I also get to work with Futures Without Violence, and I work with the Department of Health Services. And I am very pleased to introduce our next panel. Well, I'm actually just going to introduce our moderator, Virginia Duplessis, which many of you probably know. She's pretty famous in this space. So Virginia is the Associate Director of Health at Futures Without Violence and also the Director of the federally designated National Health Resource Center on Domestic Violence. And she provides oversight for a range of initiatives that are all designed to improve the public health response to intimate partner violence and really increase the capacity of folks doing this work and addressing DV and health with survivors. She's worked in DV, sexual assault, and public health for over 20 years. And she is trained as a social worker, and she's also done a lot of work with the community and as a prevention educator and with advocates. And I get to be lucky enough to be able to work with her and call her a colleague and a friend. And I think you guys will love this panel, which is really a part two to this conversation, bringing it down to the local level, what folks are doing to help break through those barriers. So I will welcome Virginia.
Okay, let's see. Does this one work? Hello, hello. Good morning, everyone. Good morning. Oh my gosh, I'm so embarrassed that Jennifer read my whole bio. The thing to know about me is I was born in LA, raised in the Valley, back here in Southern California for about 3 years. And then besides all those things that I do professionally, I'm a mom, I'm a doula, I'm a skateboarder. Yeah, I learned for my 50th birthday. That is my fun fact. I'm going to welcome our panelists to come up because you want to hear from them, not from me. So we've got Cynthia, Joby, and Courtney. Come on up. We actually have a couple, I think we're running a little early. Oh, we're right on time. Great. Yay, come to the stage. Yeah, sit anywhere. Uh-oh, where'd Joby go? Joby's driving from San Bernardino, so, oh, she is here, okay, great. All right, so as Jennifer mentioned, we are going to be reflecting on some of the comments from that first panel, thinking about the larger system issues and how that trickles down in some ways to local programs. And so we've got some superstars joining us on the stage today to talk about the incredible work they're doing in community to address this intersection of health and violence with the community members. And I'm stalling because Joby's not here yet. Maybe we will just go ahead and start with intros. All of the bios are in the program book, and I have some fun facts to share about the folks that I'm sharing the stage with. So we're going to start with Cynthia, who's a forensic nurse and outreach coordinator at the Center for Assault Treatment Services at Dignity Health. And you are sitting in the presence of an amazing cat parent. Her cat, Bella, is a polydactyl and has been a National Geographic Little Cat of the Week. There are not many who can say that.
I'm very proud. Yes, yes. So she's 16 years old, just so you know, and just still kicking. Yeah, she's still going. I had to throw the CAT in there because our program is called CATS, C-A-T-S, Center for Assault Treatment Services. You see the connection? There you go.
Yeah. And then we also have Courtney, the Mobile Care Clinics Operations Manager at Central Neighborhood Christian Health Clinics. I met Courtney a couple months ago through the LA County Domestic Violence Council, and she's doing incredible work making sure that survivors have access to health care through her mobile health clinics. And she likes to bedazzle things, so I'm kind of surprised you're not wearing anything bedazzled today. I know the day is young. Perhaps she's going to throw on a bedazzled cape. I'm not sure. And she finds repetitive tasks relaxing. So if she wants to work on my federal reports, I would love that. And then we have Joby, who I've known for so long through the Domestic Violence Healthcare Partnership. That was 14 years ago, funded by Blue Shield of California Foundation, where we had teams around the state that were partnerships between local domestic violence programs and local health programs. And Joby has been a superstar ever since. Futures hosts a National Health Conference on Domestic Violence, which we're having next September. If you go to our website, you will see Joby on the front cover. She might be holding a can of Dr. Pepper because she bleeds Dr. Pepper. This woman.
I don't know if that's something to like brag about or if it's just like a curse of the field, you know what I mean? But yeah, and I'm so glad to be on that. That's like my modeling debut. I hope that's like my retirement transition into like conference media modeling, you know?
Yes. I am also on the webpage with no gray hair. That's how you know the conference was a while ago. Okay, we're going to go ahead and jump in because I want to give our panelists an opportunity to share all of the work that they're doing. But first, let's just hear a little bit about your programs. And do we want to start with the dignity? We've got multimedia happening. With the video? Oh, Jennifer's making a face. We're going to start with something else. We're going to start maybe with Courtney, if you want to just tell us a little bit about your program.
Hello. I'm Courtney Hoffman. I've worked at Central Neighborhood Health Foundation for over 10 years. And for the past 3 years, I've been working with the mobile clinics. We go into shelters for domestic violence, homeless, and rehabilitational shelters. And how do you say it? Give me a second. Permanent supportive housing, there we go, to service DV victims and survivors, because as we all know, they're everywhere. So we try to cast our net pretty wide so that we can try to help everybody. We provide primary care services to them. If they do not have insurance or if they have private insurance, Central Neighborhood Christian Health Clinics will cover the cost of those services for their labs and our in-house services. We also provide them with medications.
That is amazing. We know that two major barriers for survivors accessing care are cost and transportation. So to have, healthcare in the community is a critical need, and especially thinking about safety. Maybe the person who's harming them knows where their old, clinic or place they got care was, and so this is a way to add that additional element of safety and flexibility.
Yeah, providing the trauma-informed care on site has made a great impact. A lot of these women haven't had health care in quite some time. So to be able to give them a pap smear right then and there, that's amazing to us. That's what we wanted to do and what we're able to bring to them, as well as the STDs and STIs. A lot of people aren't even comfortable talking about that. So to be able to have that quiet, closed space to be able to release what you need to release and say what you have to say to get the help you need, you know.
Great, thank you. Joby, do you want to talk a little bit about the work you're doing at Family Assistance Program?
So I'm going to talk just about Family Assistance Program, just kind of an overview and then specific on the DV, because where I am at in that program now is so different than where I was when you first met me. But I'm with Family Assistance Program. I've been there for 10 years. It was 10 years this April. So that was, before twins, before grays, wrinkled 100%. Our program, we are based out of San Bernardino County, so this was a trek for me to get you. Kudos to all of you that have to drive that freeway traffic and that street traffic. I was like, what is going on? Where are all of you coming from? Where we are in our area, a very widespread rural area, our program services victims of domestic violence, human trafficking, homeless and runaway youth, as well as homeless and runaway TAY youth. And there's probably something that I forgot, so if you look on the website, don't like super hold me, quote me to it. I left my house early this morning, but we do a lot. Specifically in our domestic violence program, when I came into the program 10 years ago, there was that lack of healthcare services for our DV victims coming into the programs. Not only that, we didn't know the window of time that we had them. In those rural areas, we have a lot of small town politics, 6 degrees of separation. As much as we want to keep our shelter confidential, half the community probably knows where it is, sadly. So again, there were those barriers getting those victims that were coming in access to health care, whether it be mental health care, just physical health care. Again, we all know coming from a situation where we are a victim of domestic violence, we have a plethora of things that we need to address coming out of there. Leaving is that first step, but there's still just so many other things that need to be addressed. So that's when we had entered the Domestic Violence Healthcare Partnership. We had gotten the grant, and through so much guidance with Futures Without Violence, and then our cohort was large. There was just so many and programs from all over the state. We were able to feed off of each other and build a really great relationship with our local San Bernardino County public health care system. And through that partnership, we were able to get our victims coming into our programs what we called golden ticket appointments, golden ticket access to fee waivers, and help get them access to the services that they needed right then in that moment, and not weeks later. And through what we learned, we've been able to sustain that partnership, and then coming into it with the new grant, which is what brought us here to speak today, build off of that and include other domestic violence agencies within our county. And I'm going to talk a little bit more about that in another question. But that's a little bit about who we are.
Great. So a couple things that really stick out to me is this opportunity to have expedited services for survivors and how important that can be. Oftentimes, when survivors are, coming in for support and services, we don't necessarily have a lot of time, right? And so the sooner that we can help get people connected in for care, to not be dwindling on a super long wait list, because, as we talked about earlier, the impact of experiencing violence on your health can be significant. I think Dr. Ramos spoke very eloquently to that. And then just also a shout out for those of you that may not know, thinking about survivors accessing care who might be using Medi-Cal. Experiencing domestic violence is a qualifying event, so you don't need to wait for open enrollment. And so if you have survivors who do need to sign up for health insurance, they can do that at any time. You don't need a police report or anything like that. You just have to self-certify that you've had that experience, and then you're good to go to change your plan. All right, so we are going to use our multimedia chops here and show a short video to highlight Cynthia's work.
The suspense, right?
I know.
It's got to be really good
This
now.
video's so good. Oh my gosh. been featured at South by Southwest, Sundance, up for an Oscar. But the site
That was
can't
my
be
acting
reached.
debut. So this is why I want to show it to make sure everybody sees it.
Yes,
Soon.
this is a preview. We might need to have a live reenactment.
Oh, all right.
Okay.
No problem. Okay. So I will just talk about our program. It's very, very unique. So Dignity Health, our program is called CAT, Center for Assault Treatment Services. And it's a one of a kind, only one north of San Diego, where we have the medical model really is a one-stop shop, where we have several agencies collaborating and working under one roof to really limit and try to address some of those barriers that survivors might have when they come through experiencing an acute or possibly non-acute situation. And so we have our program. We would do the forensic interview. We do a head-to-toe examination. And we also offer what we call aftercare. We can discuss medical instructions, offer antibiotics, medications that may or may not be warranted, depending on the situation, if applicable. And then we collaborate with our other partners. So we have advocacy group on site, and we also have, unique to us, is domestic violence detectives on site. So all of the egregious offenses from the local divisions, LAPD divisions, all come over to that one. They're in the back office, and they have certain cases that they're like, hey, we would like to have this one come in. We want you to conduct the forensic interview and or examination. And it's unique because unlike other programs, I don't know about you guys, but if you're about to share something potentially embarrassing or personal about your body or concerns, most people feel more comfortable talking to medical personnel, right? Versus a detective patrol officer, things like that. So what we find is by doing our forensic interviews, people just feel more comfortable. We get more details, actually, from doing it that way. We audio and video record our forensic interviews. This is going to limit the number of times somebody is going to have to repeat that story, right? Furthering the trauma of having to go through that again. And then we'll conduct the head to toe, we'll take photographs, and then again, we link them again, because again, it's all about centering on the survivor's experience. So then we'll link them in to appropriate, whether it's with us for follow-up or outside resources, references to the community that for other kinds of care.
That is so wonderful, really thinking about wraparound services, reducing the potential for re-traumatization, and having that kind of one-stop shop can be so valuable. Again, we don't necessarily have a ton of time over the long run with survivors, so as much as we can do when we do have them and we're able to provide that trauma-informed care, it's incredible. Thank you.
Welcome.
So I gotta admit that now we're gonna go a little bit negative, but we're gonna get positive right after that, because the next question is really about barriers. What are the barriers that you've seen for the folks that you're serving in your community to really being able to address their health needs? So we're gonna start with you, Joby.
So for us, and again, keep in mind, I'm in San Bernardino County. We are very spread out. We have a lot of rural areas. And I was sitting here thinking before, it's so, it's kind of just so weird because actually it's not weird. It's a blessing because in those rural areas, there is a DV program somewhere within that area. 100% love that. But in our major quote-unquote city area, we have one program. So oftentimes, a lot of those individuals get kind of safety transferred into those more rural areas. And unfortunately, we have limited to no transportation to healthcare services or lack of services. You know, many of our specialists, you have to come what we call down the hill. So my program's located, or our admin office is located in Victorville, California. So again, that's a 45-minute on a good day, you know, drive. And a lot of these health insurance providers, you know, they have transportation services in play, but I really wish when they would go to make these transportation services, they would bring some of the populations or the people servicing the populations that are utilizing them to the table, because even with those, there's so many barriers. You know, you can call one person and it's, well, you need to call within 48 hours, and then the next time you try to call within that, no, call within 24 hours, and then you call the 24 hours, and now you don't have enough time. And of course, when you're a victim, that's, you know what, I'm done. I'm not even gonna, I'm just not gonna go. It's not worth it. You know, or thinking about, you know, having to access what they utilize for transportation. And if I'm someone and I'm trying to go to an appointment and, you know, I have to transport my 5 kids with me and 3 of them are in car seats and I just fled and left everything. And so, you know, the shelters, yeah, we do have some that we can provide, but if we have a client going to court on the same day that we have 2 clients going to health appointments, now we have this issue. You know, and then especially for our shelter programs, you know, we are underfunded and understaffed across the board, across the state. You know, we are all fighting to keep our services, you know, available to the community. And when you have to, when you're sitting at the table trying to figure out, okay, where can I take a little bit to put a little bit here to cover some mileage? Or how can I pull, how, you know, is my shelter going to be okay short-staffed if I have to pull this staff to transport? So it gets very, very difficult for the programs to support, you know, getting individuals there. And then again, when you're pushing them out and we're in the rural areas and there's lack of services, it's pretty difficult. We have a lot of car washes though, so, you know.
Yeah, you know, I think you speak really eloquently about this need to make sure that the folks that are coming in for services and support are having their basic needs met, right? And oftentimes that is at the root of not being able to seek out those more like therapeutic support services, because it's a matter of the nitty-gritty. Breakfast, getting my kids to school.
And not only that, but thinking about too, like, again, oftentimes, you know, they don't have documentation, but we need to get them seen, or they, you know, or they're supposed to. Oh, how many times have we been in a shelter and you have a client come in and they're like, well, I'm supposed to take medication for this, but I haven't taken it in 6 months, and it's like a heart condition or blood pressure, and you're like, oh, and again, just getting them to that place and even getting another thing too that we deal with is oftentimes we'll get victims that come from LA, and it is so difficult to get LA County and San Bernardino County to communicate. Like sometimes I want to just be like, can I just drive over there and get their file, and then I'll drive it to the TAD office and I'll input it. You know, I don't understand, you know, and I've even tried to ask. I've tried to speak to you know, I had a conversation with someone from IEHP one time. I had a conversation with someone from LA from one of their TAD offices, and you know, I get it. There's more people than what we can service in a sense, but it sucks when they're like, no, it's not us, it's them. No, it wasn't us, it was them. And this whole time you have this victim here and you're like, I swear, wait, I promise, give me 48 more hours, like you can do this. And yeah, it's messy. It's a messy, our system.
I mean, look at the name of our symposium, right? Is Beyond Silos. How do we move out of silos, right? To make sure that we're providing the best, most effective trauma-informed services. Yeah. All right, well, I'd love to hear from Cynthia. Yeah, your biggest barrier to addressing this intersection of health and IPV.
There's a couple, like you had mentioned, but one of the other things I just wanted to flip a little bit is thinking about sometimes the fear of like, I'm not really sure what happens after this, and also the frustration sometimes with not only survivors, but also healthcare staff, especially if that survivor has taken a step forward. This is now their third, fourth visit, and maybe things didn't turn up, and now they're coming again. And sometimes there is that frustration on their part because they don't understand, the psychology behind taking that first step, and maybe it's the fourth, fifth time you're there. And so sometimes, and I know that even from, and I can tell you this from working with the other partners, is more education on understanding the psychology behind, so you don't get frustrated with that individual that finally comes forward and is seeking help. We know a lot of times when we do our interviews, we know that this is not the first time, most likely, something has happened. Typically, something has changed. Something became more, there was a change, whether with a threat or perhaps there was an escalation in the physical violence that happened that caused them to now move forward. But again, just making sure that we are patient with that survivor to know, hey, we get it if we need to take a pause, because I do see it sometimes in our healthcare system. We go, oh, here we go again, they're back again. Nothing always happens, the same thing. And I think we just need to remember that and educate more so that they understand what's behind that and how hard it is to come forward, to take that step. I think not giving them that credit. Among other things. I mean, we all come across, we have more, our area covers the San Fernando Valley, Santa Clarita area, but again, that doesn't mean things are not happening all around us, and we really try to be as open as possible. But like you said, there are more individuals than there are providers that can really to be there. And so we're just really wanting to make sure that those that are there don't get burned out, because that impacts the ripple effect, right? For someone to come forward and go, I'm not gonna go talk to law enforcement, I'm not gonna talk to this person, because the last time I went there, they treated me like this, So trying to address it from multiple points, in the cascade of how we interact with each other.
Yeah, I think that you bring up some really important things to think about in terms of the supports that we also have for the healthcare workforce, because it's not as if no one in healthcare also has this experience currently, previously, in the homes they grew up in, and that can impact our ability to talk about these things with patients and clients. I think maybe in advocacy programs, it's a little more common to acknowledge the trauma and healing and resilience of the workforce, but in healthcare, it's a little bit different, I'd say.
Yeah, very much so. Yes.
And
you understand why we get this dark sense of humor sometimes.
Yeah. I mean, for a lot of providers, you're not seeing them when they're having their most awesome day.
No. You're going there for a reason.
Yeah. So just to think about how we can also support the healthcare workforce so they can do this work in a trauma-informed and sustainable way is important. And I know that that's also a big part of your program, and your program's philosophy is taking care of the caretakers as well. All right, so we've heard these barriers, but now we're going to inspire people. Giggle, giggle. To hear about how your programs make a difference. So one of the things that we talked about in our planning is, what is that like one story that if you had maybe a funder in the room, you would tell about your program and how you see these great ideas coming to life? And I want to invite all of you to answer this question. Yeah. Maybe start with Courtney.
Hello?
Yeah.
Okay. So they brought up a bunch of barriers that they're not unique. This is something that you all are dealing with every day, especially the transportation, the health insurance, it's hard to know how to navigate these systems. For us, we've been able to break down some of those barriers for you guys. So you don't have that insurance barrier because we're going to see them, we're going to cover it. At each and one of our brick and mortar clinics, we can send a DV victim or survivor there. They can go and receive services. All they have to do is say they're a victim or survivor. We're not going to beat them over the head for their ID and all that. They can just, it can be very simple information that they have to provide to us without having actual documentation. We provide transportation to and from our locations so that they have the access to the services if we can't be there ourselves in person to break down that, as Jody said, like, you know, they don't want to go no more. Like, I don't want to do it anymore. This is too much. It gets really hectic for them because they're already going through so much, and then they have to try to take care of their own healthcare needs, and they can't get their needs met. So that's what we do as far as that. We break down a lot of the barriers. The health insurance is like the biggest one. If they have private health insurance, we will just cover their costs. We won't even take their insurance information.
So when we met, it was a cloudy day, and I felt like Courtney walked in the room, the clouds parted, and she shared so much about her program. I was impressed and grateful. You talked about the barriers to survivors, but the other thing that I learned is reducing barriers for folks that are making referrals. So here's a little secret. Courtney has a phone that only the DV programs have the number to. So if that phone rings, she knows this is someone who has a survivor that needs help. So it's not like, let me call this 1-800 number, go through voicemail jail, never reach the person I actually need to talk to. That's one of the biggest things that we heard. We try to partner with healthcare, but we can't. The system is too big.
I'm the person you're going to But I didn't really get to share my barriers. The biggest barrier I have is trying to get into the shelters, trying to get into your guys' programs. It's not easily accessible. When I call over the phone, nobody knows who I should talk to. Nobody wants to really talk to me about it because I guess I sound maybe like a salesman on the phone. But, you know, you guys be a little bit more open and receptive to services. That would be really helpful.
And to add to that, also just the family unit in consideration, because I agree the shelter is one big problem when we do get patients coming in here. But remember, it is a ripple effect. It's a family unit. So sometimes there's limitations like, oh, there's a male, adolescent male. Oh, well, you know, we have to figure something else out. And so I have to definitely mimic that that concern with the barriers, consideration of like them as a family unit. And that's a barrier for someone to come forward and say, I'm experiencing this, but if I go here, they won't take my son, or, you know, they're out, you know, so that, again, just, you know, in the big scope is looking at the big picture and how can we support, you know, the whole family unit.
Well, let's hear how you've done that, a big success story for you.
Well, I did share a little bit about our model and how we have patients that come through and they feel more comfortable. We had, I told you we had some of our DV detectives in the back. We had a great success story where we had a felony DV charge get upgraded to an attempted murder charge because of the details that the forensic nurse examiner was able to obtain in that interview that nobody else knew about. The detective was listening, was like, what? Oh my goodness. And started just going off of all of that, was able to present it to the DA and was able to go and get an attempted murder charge on that particular case because of those unique details that that examiner was able to collect. And that's what makes it really unique, is partnering together to see, and also consideration of what makes people more comfortable. Think about it, it just seems more common sense, right? Like, I do feel more comfortable telling someone, and also for that person to know what questions to ask, right? Because sometimes we always start our interviews as very open-ended, you know, tell me what brings you in today. but then knowing what questions to ask so that they go, oh, now I know I can actually go here with this. Tell me more about that. So that was one of our great DV success stories. We're so happy with that because those are really hard to get. So.
Yeah, I mean, this power of collaboration, right? When we work together, we're able to really meet the needs of the survivor and also kind of the goals that we have within our programs for providing services and helping identify solutions with survivors that are coming to us. All right, Joby, let's hear a story from you.
Remind me at the end, I want to speak on what you had said. It's kind of, I think, in my last question about, the shelters and healthcare and getting in there, because I was in the trenches, I think I have a lightweight solution. For us on our end, one success story that I love to tell is, it's about around collaboration, and it's within collaboration of the shelters in our area. One of the things I really respect about my executive director is he's not the type of individual that goes into state, community, federal, whatever, and looking for grant funds and thinking, how can I take all this money and make it my own? That's not him. He's like, okay, look, I know my community could use this. I know that our county could use this. So how can I bring, our other shelters to the table and say, look, how can we get this money together and make the best use of this? And I don't know the exact technical term of the grant. I know that we call it the FO grant, the one that you had asked about, with that we do the health advocacy, that we're able to do the mobile health advocacy. What's the official grant name?
Oh, the ARP COVID-19
No,
testing
it was the one that you
vaccines
talked
mobile
to
health.
Kevin about. I don't. But based on a grant we had, it might be. I don't know. I just know what we have it labeled as on our little sheet. But based off that grant, they brought our county collaboration together and said, okay, we're going to hire two health navigators, and one that is completely bilingual. We're going to get this great little electric car so that way we can, save on gas and all of that. And we are going to come together and we're going to create a system in between our shelters to help get our victims and our programs to their healthcare appointments and just really see what's needed. These health advocates are covered California certified, so if an individual doesn't have healthcare, they can enroll them through that, or with our relationship with the county, they can get them straight into the county, get them seen by a Medi-Cal worker right away. And again, this is something that's going between all 6 of these shelters now, and this has sustained. And because of this, our shelter out in Barstow, I don't know if you guys are familiar with Barstow. We have the original taco, or Del Taco, woo woo, stop there on the way to Vegas. Right, that's how everyone, we're the Vegas stop, Victorville, and we got a Chick-fil-A now too, so we're really hip hop happening. Yeah. That they're out there, okay? So I'm 45 minutes from. I'm at least a good hour from Loma Linda, which is one of the major medical centers in our area. So that means that Barstow is probably, on a good day of traffic, an hour and a half, maybe 2, because of the program that we had going on. Our health advocate, there was an emergency. There was a child there that had a feeding tube. The feeding tube came dislodged. No one in the city of Barstow could see him or fix him. Our health advocate, or one of our health advocates, dropped everything they were doing. We're straight to Barstow. We're able to transport this client, stay there overnight with the mom and the child, providing support, because that's scary too when you're a victim and maybe you're having to go back to an area where your abuser frequents. And then transport them home. And it wasn't an Uber, and it wasn't uncomfortable. If they had to stop and use the restroom, they could ask to stop and use the restroom. If they were hungry, we could stop and get them some food. But that was all because the shelters came to the table and said, okay, look, we're going to split this money. We're not going to fight over this money, and we're going to work together to make the best use of this to get the best services for our clients. So that's, I think, one of my greatest success stories in our area.
I love that. Well, believe it or not, we've only got 5 minutes left. I could stay up here all day. I'm just going to say, I think you should bedazzle your health van. Okay. Now I'm going to, that needed to be said. We're going to open it up to questions and answers, or I guess just questions, whatever. Jen has a question.
I'll stand up because I don't have a mic.
Nope, I'm gonna
oh, okay. I'd love to was this really loud? I'd love to revisit, Courtney, what you said about the barriers getting into DV programs. One of the things that I've heard from several DV programs is concerns around privacy and confidentiality. So I wonder if you could talk a little bit about how you navigate that.
So, well, when we're registering a client, we do check their health insurance. If we notice it's private, we immediately do not enter that into our EHR system. And in our EHR system, they are identified as a DV victim or survivor. And everybody in our clinics has been trained to notice where that's at and communicate the information very delicately after. So if you call and you're asking about that person, instead of the 3 identifiers, you have to ask 5. If you don't have all 5, then you're not going to get any information about that patient.
I want to speak on that really quickly about the barrier you face getting in. I went through that when I first started in my job, and I was like, how do they expect me to do this? One thing that I noticed is, in the medical field, they don't realize that they need us. If you go in there like, hey, I'm going to tell you how to do, or you're not doing. No, I want to support you. I know you guys don't have a lot of time to deal with the victims, but that's where I do. I can come to the door. Here, let me talk to you about it. And coming in as more of that support system really helped me on the medical end. On the shelter end, we've had our hearts broken a lot of times. People have came and knocked on our door and promised us that they were going to do all these great things, and they did half of a thing, and then we never seen them again. It speaks volumes when we see a face that comes out and not only that, but is asked, wants to know, what do you do here, and what do you need, and that type of thing. So just a little plugger in there as to how I got my hands in the door a couple of times. You know what I mean? When I was trying to create those bridges.
Oh, you guys are traumatized. I understand now.
Yes.
So I work with over 35 shelters, and for all the shelters that I do work with, you can ask them. They can call my phone anytime throughout the week if it's for medications, actually just donations, because we also support the shelters themselves. So we have formula, diapers. One lady asked us for a breast pump, and one of our employees was actually able to donate that breast pump so that she could have it. We do go above and beyond for our clients. I can't speak about all the healthcare services out there, but I can speak about mine.
The other thing that I learned is you also can provide some services to the staff. So like when people need a TB test, or, this is really a benefit to everyone who's involved in your program, staff and survivors and kids. It's amazing, honestly. Everyone get Courtney's card. Oh, do we have another question? I know we're running out of time. Uh-oh.
Hi, good morning. Thank you all. This question's for Courtney. Courtney, I'm a deputy district attorney handling domestic violence cases out of Los Angeles. Seated with me are some of our fabulous forensic nurses. One of the barriers I have is trying to get my victims, because we're not all blessed in the different regions of Los Angeles County with centers like CATS where law enforcement is there. So one of my barriers is getting forensic exams to my victims where law enforcement isn't available to take them necessarily, or they don't want a forensic exam right away, so we have to get them there later. One of the barriers specifically is transportation. So I'm curious, would your organization be able to provide that? If they don't come to you, if we just needed transportation, since I know your organization, you already told me, doesn't provide forensic exams.
That's a good question that I do not have an answer for today, but I can get you that answer. I believe you did grab my business card, right? You can reach out, text me, or email me, whichever you're more comfortable with, and I'll get you an answer.
All right, we are about out of time. I don't want to keep anyone from their break, so I just want to invite everyone to offer a round of applause for our panelists. Really inspiring, doing amazing work in the community.
We want to thank our sponsors, the Blue Shield of California Foundation and the National Health Resource Center on Domestic Violence.